Hello everyone, welcome back to the UKMLA Roadmap series where we walk you through the MLA content map. Today we're going to talk about clinical imaging. I noticed misplaced nasogastric tube as the first thing written in the presentation section. This is something that is very frequently tested on your multiple choice question exams where they'll give you an x-ray and ask you if the nasogastric tube is correctly or incorrectly placed. So make sure you familiarize yourself with images of nasogastric tubes, in particular x-rays. Next, you have trauma. This may show up as a patient in A&E, and you need to identify a lower limb fracture. So you just need to identify whether a fracture is present or not, and if it isn't present, then maybe it's a soft tissue injury. So make sure you know how to identify and diagnose this. Okay. Next, you have aneurysms, ischemic limb occlusions. Just make sure you know the investigations that you need to perform in these cases, whether it's a CTA, an MRA, an angiography, an ultrasound, whatever, right? Just make sure you know the relevant investigations in these cases. It is unlikely that they'll give you an image of these investigations and then ask you to diagnose the case without any kind of background information or examination findings. Okay, so don't worry about that. Just make sure you know which investigations are performed in which condition. Next, you have bladder cancer. So make sure you know that CT scans, what kind of CT scans are performed, and then PMRV may be done in a bladder cancer scenario. So just make sure you know the investigations. Next, you have breast cancer. So ultrasound, mammography, all that stuff. So make sure you know which investigations are performed in the case of breast cancer, or in particular the imaging that's performed. Okay, again, less likely that they'll actually give you an image and ask you to diagnose the case without sufficient background information. Next, you have bronchiectasis. In this case, make sure you look at CT scans of the chest with bronchiectasis, okay? Because that may actually show up in your MCQs or your OSCE stations. So just make sure you familiarize yourself with CT scans of the chest where a patient has bronchiectasis. Next, you have cardiac failure. In this case, you need to know that an echocardiography will be done, a chest x-ray might be done, and also you need to know the findings you might see on an x-ray. So you might see pulmonary edema, you might see cardiomegaly. So just make sure you look at that as well. Next, you have colorectal tumors. Make sure you know that you need to do a colonoscopy or sigmoidoscopy maybe. You might need to do a CT scan, and also how to explain these findings to the patient. You need to know how to explain these findings and any of these imaging modalities. You need to explain them to the patient in very simple terms. Okay, so if you want to figure out how to do that, you can actually search the particular imaging modality and write NHS in front of it and Google it and see it written out in very simple terms. So that it's easier for you to explain it to the patient. But in colorectal tumors, you usually just have to counsel a patient on a colonoscopy, maybe the whole procedure, how it's going to be done, and what they need to look out for. Next, you have extradural hemorrhage. Now, any kind of intracranial hemorrhage, whether it's subdural, extradural, epidural, you need to make sure you are very familiar with the image of then intracranial hemorrhage. You need to know how to diagnose intracranial hemorrhages and which kind of intracranial hemorrhage it is. Okay, so even without the background history, you need to know what these hemorrhages look like on a CT scan. Okay, so make sure you do those well. Next, you have intestinal ischemia. In this case, just know which investigations you need to do. Intestinal obstruction and ileus. This may actually show up as a scenario where they give you information, but then they also give you an image in a multiple choice question or maybe an OSCE station. But make sure you know how to confirm a diagnosis of intestinal obstruction or ileus on imaging. Next, you have intussusception. This usually just shows up as an ultrasound finding of a target lesion in a child. Okay. Next, you have lung cancer. So again, you might have to do a CT, you might have to do a chest x-ray. Usually this shows up as a chest x-ray and you need to look at maybe a coin lesion or maybe some kind of mass on the chest x-ray. So make sure you look at chest x-rays of lung cancer. This may actually show up in your OSCE stations. Next, you have osteomyelitis. For this, make sure you look at not only x-rays of osteomyelitis, but also the findings. So the findings written out. How you might get, a sequestrum and involucrum in osteomyelitis. So just make sure you know the findings you might get on an X-ray when it comes to osteomyelitis. So this may actually show up. Pathological fractures, these will just be simple fractures. You'll diagnose it more so after looking at the past history of the patient. Next, you have placenta previa. This is important when it comes to your OSCE exams or even MCQs because they'll give you an image of placenta previa. To make sure you look at images of placenta previa. Usually I've seen them give drawings of placenta previa where they have the drawing of the uterus and a child inside and the placenta. But yeah, that's what usually shows up. So just make sure you look at diagrams of placenta previa. This does show up in OSCEs very commonly. Next you have pneumonia. Again, X-rays and CT scans of pneumonia. Make sure you familiarize yourself with them. Next you have pneumothorax. This is very commonly tested when it comes to MCQs. May show up in OSCE as well. Make sure you know how to look at a chest X-ray with pneumothorax, okay? And how big the pneumothorax is and what you need to do according to how big it is, okay? So make sure you do this well. Next you have pulmonary embolism. Just make sure you know that you need to do a CTPA in pulmonary embolism. Okay, raised intracranial pressure, know which investigations you need to do, in particular CT scans, MRIs, right? Next you have your spinal cord compression. In this case, make sure you know how to look at spinal cord compression on an MRI, okay, on an MRI scan, okay? Next you have spinal cord injury. Again, make sure you know how to look at an MRI of the spine and identify a spinal cord injury on that. Next, you have spinal fracture. Make sure you look at X-rays of the spine with spinal fractures, and this may show up in MCQs or OSCEs alike. Next, you have stroke. Again, look at CT scans. Okay, make sure you look at CT scans and make sure you know how to identify whether a stroke is present or not. Next, you have subarachnoid hemorrhage. We've already talked about intracranial hemorrhages, subdural hemorrhage. Next, you have surgical site infections. So in the case of surgical site infections, just make sure you know that you need to do an ultrasound scan, okay, to see what's going on exactly. Next, you have upper limb fractures. We've already talked about this in trauma, so make sure you know how to identify fractures on an X-ray. Upper limb soft tissue injury, same thing. Next, you have volvulus. In the case of volvulus, this may be of, so make sure you know the findings that you may see on an ultrasound or an X-ray in this case, okay, in the case of volvulus. But they'll give you sufficient background information when it comes to a volvulus, so don't worry about that too much. So that's what you need to keep in mind when it comes to clinical imaging. And yeah, hope this helps. See you in the next video.